And welcome back. Well, how long have you had pain in your back, your hip, or your leg? Many people suffer for a very long time before doing anything. So today we're going to tell you about a combination of 2 advanced technologies to help you decrease or even eliminate your pain. Stacey Roberts joins us live. She is the owner of New You Health and Wellness. And in just a moment, we're going to hear about 3 different women who've had success with these therapies. It is so good to see you, Stacey.
So good to see you too, Tiffany.
I love having you here. You know it. I love what you're doing. You've got to talk to us just a little bit about how common back and leg pain is. I feel like I've suffered in the past. A lot of people live with this for a long time.
Absolutely. You know, stats show that 80% of Americans will at some time deal with back pain. I even think that's higher if you look at like any issue with back or leg pain. So it's a very common issue, and sometimes it can be treated really easily with straight up physical therapy. But sometimes, like the 3 cases we'll talk about today, they have nagging issues no matter what they try to do.
Yeah, and so before we get to those, because I love the fact that you have these great testimonials of these 3 women, tell us a little bit about the referral, right? Because oftentimes we've got back pain, it starts there, but then all of a sudden we've got hip pain, we've got leg pain, we've got foot pain, and it refers to other parts of our body. Why does it do that?
So depending on the type of injury the person has, so specifically if there's disc involvement, those are the cushions between the vertebrae and the spine. If there's a disc that's pushing out against the nerve in the back, sometimes it's referred to as a slip disc or a pinched nerve, that can, depending on how much pressure is on there or how much inflammation is around that nerve, that can cause pain to actually go down into the leg in different areas. And when you go to somebody who understands that, depending on where the pain is, can tell you what level of the spine is affected. So the hip, oftentimes you'll have pain in the hip or the leg, front of the leg or the back of the leg or the foot, but no back pain whatsoever. And it's actually coming from the back.
See, that's incredible to people. They might be, I mean, I've had sciatica pain before, and a lot of people have had very specific lower back pain. But what you're saying is we might have the leg pain, the foot pain, the hip pain, and not even realize that it's coming from our back. So talk about this technology that you use. It's tech, and how it really helps eliminate or potentially, help with this pain.
Absolutely. Well, your viewers have heard me talk about SoftWave before, which is the modality that we use to decrease inflammation. So in combination with SoftWave of decreasing the inflammation, we add in tech, which is transcutaneous electromagnetic contraction, and it helps to strengthen the muscles around the core and the buttocks, the gluteal muscles as well. So a lot of times it's used for body contouring, but we found it to be really helpful with strengthening that area, because sometimes when you have these types of injuries, doing regular sit-ups to strengthen that area actually makes it worse. So we want to strengthen that area first to get a good foundation in both the hips and the glute muscles. And then there's also an anti-inflammatory effect there. I was really surprised when I put these patients on there. It just was doing it for strengthening, wasn't thinking that the pain was going to come out of their legs. And many times the patients, as you'll see in the testimonials, said that the pain came out of the leg, the congestion that they felt, the numbness that they felt decreased or was completely eliminated in their leg after doing this. So we're finding even more uses for this than just the strengthening.
Well, and Anna is one of those. She had back and pain that was kind of going down into her bum as well. And she actually has a full testimonial talking about the fact that after 6 months of seeking treatment for what she would have referred to as lower sciatica issues that were unresolved and becoming more debilitating, she saw you. She tried massage therapy, chiropractic, all these guided stretching, other physical therapists. And she says that tech that you use after 1 treatment, she significantly had reduction in pain as well as numbness. After 2, she was pain-free, and after 3, the numbness and tingling completely went away. So what did you do with her, and why did this work, do you think?
So again, we started with the SoftWave treatment that advanced to tech, and then the combination of the 2 with the strengthening and the decrease of the inflammation deeper than they could get to in the past, because she was very active. She didn't want to just sit at home and wait and rest and, say, okay, I'm not going to do anything for months until this resolves. She wanted to stay active. But the combination of the 2 really helped with the inflammation as well as the strengthening and got her back to playing tennis regularly without any pain and no symptoms in the leg anymore, which even surprised me.
Wow. See, and I love that. I'm sure you're like, yay, it surprised me. And that's exciting because that's what you're there to do. I've met you, you've helped me with some things, and you really do want to help. You want to heal. So real quick, let's go on to Melanie, because this was a case where you felt nothing was, what she felt, nothing was helping.
Yeah. Exactly. So she definitely had herniated disc. There was congestion in her leg. It wasn't really pain. She just felt heavy, and she could barely lift up her foot after having a disc injury in her back. She was not a surgical candidate. They told her that she couldn't have surgery for this. And then with the combination, we started out with SoftWave, got a little bit better, but we couldn't get longer term results. Then we added the tech as well. And boom, she got off the table and was like, I can lift my foot. And her foot became stronger as a result. Her leg, the congestion came out of her leg, and she finally could get back to exercising outside of the pool and back to weights and land exercises, in addition to the aquatic exercises to help her continue strengthening.
Stacey, we're almost out of time. We've got less than a minute, but talk about Leona, because she came to you originally for back and then had other things healed as well.
Actually, yes, she came originally for shoulder, and then she talked about her back pain, that nothing else could help. And I'm like, hey, let's give this a try, because it's helped these other people like Anna and Mel. And again, she was one who, after one treatment, got off and was like, oh my God, this is amazing. It's completely gone. So she's now had 3 treatments, and this was years of hip and back pain for her, that this treatment has really kind of moved the needle for her and the other 2, that Anna and Mel as well.
And she's the one who said simple tasks like just going to the grocery store. Now she doesn't quickly go for the cart for that stability because she's doing so much better. Thank you so much, Stacey. You brought an incredible opportunity for people to meet with you, so I want to share that. Thanks for joining us. Absolutely. No. And when you call New You Health and Wellness, make sure that you mention the Morning Blend. Why? Because you'll be eligible for a free trial of the tech at or before their open house on Wednesday, April 12th. Or you can get 50% off your first session after April 12th. All you have to do is call 414-299-8121 or visit their website. It's newyouhealthandwellness.com.